All right, good afternoon, everyone. Thank you for the introduction. My name is Kevin Yang. I'm a fourth year and in my last year of medical school at the University of California, San Diego. First off, I want to thank Sarah and Rupert for having this conference and for having me here today. Very excited to be here. Also wanted to just acknowledge my colleagues, Dr. Benjamin Hahn, also from the UC San Diego, as well as Joseph Palomar from NYU School of Medicine. And as you can see, the title is Recreational Ketamine Use is Associated with High Risk for Depression Among Adolescents, but not consistently among adults. Acknowledgements and disclosure. So research was supported by the NIDA, the NIH, and also all authors have no conflicts of interest to disclose. So for some brief introduction, major depressive disorder is common in the United States among both adolescents and adults. In adolescents, it affects almost 1 in 5, and in adults, it affects almost 1 in 10 adults. And the rates of these are increasing in the United States as well. Additionally, major depressive disorder and suicide are highly related. Suicide is also the second and 10th leading cause of death among adolescents and adults in the United States, respectively. And major depressive disorder is also highly associated with psychoactive substance use, particularly with respect to alcohol, cannabis, and opioids. So as such, it appears that those experiencing depression may be at risk for other psychoactive substance use as well. And here comes ketamine as a treatment for depression, because of all the comorbidities associated with depression and because of just the increasing prevalence, there's been a big need for innovative and effective treatments for depression. And so as you guys are all aware and why we're all at this conference, in the past decade, there's been many, many studies that have demonstrated how ketamine is efficacious in managing treatment-resistant depression, with research also demonstrating efficacy among adolescents as well. This is just a forest plot taken from Marcantoni et al.'s paper in Journal of Affective Disorders in 2020. Just an example of how you can see from the systematic review that in comparing placebo to ketamine, it certainly does seem to favor ketamine. And subsequently, as you would expect, there's been a significant increase in clinical research, media attention, and just rising ketamine clinics targeted for the treatment of depression. And most of this, of course, is all in clinical settings under medical supervision as well. However, as you can imagine, ketamine is used outside of clinical settings and outside of medical settings as well. It is used as a recreational drug of abuse. These two figures are from Dr. Nutt's papers in Lancet in 2007 and 2010. Him and his colleagues essentially just kind of use their own assessments to try and create this graph of how relative to other drugs, what is the association in terms of severity of dependence and also with physical harm as well. And you can see highlighted in the blue for ketamine, you can see it's right about in the middle in terms of the severity of the dependence, as well as the physical harm associated with it on the left graph. On the right, you can also see in terms of just the overall harm score that they created. It's right there about in the middle, maybe in the lower middle end of that as well. So, just the big takeaway from this is, while ketamine is not necessarily, a severe drug in terms of dependence and physical harm, it certainly can have dependence and physical harm and abuse associated with it. And that's kind of what brought us to led us to this study, is that we wanted to see the extent to which ketamine use relative to other drugs, what was that extent of people reporting depression? And so we did this by using 2 national representative studies. These are both in the United States. The first column on the left is Monitoring the Future survey. So this is an annual survey given to high school students. We specifically looked at high school seniors. So these are usually around 17, 18 years old. And we used the years 2016 to 2019 with an N of over 15,000. We also did another survey looking at the National Survey on Drug Use and Health. Specifically, we looked at adults 18 years and older. And these were between the years of 2015 and 2020 with an N of over 240,000. In terms of measures for substances, we, of course, looked at past year use of ketamine, and then and additionally as other drugs as well, which will be shown in the next graph. For depression, for the Monitoring the Future survey, this questionnaire, there were 4 questions that were derived from the Bentley Medical and Psychological Functioning Inventory. This questionnaire has been shown to have high reliability and high validity and has been used in a multitude of other surveys as well. And what we did is we defined it as having a high level of depression if they scored in the top 25 percentile of the average reported symptoms. And then on the other hand, with the National Survey on Drug Use and Health for depression, that was used based off the DSM-4 criteria for having a past year major depressive episode. For statistical analyses for both of these, we did bivariable comparisons using Rao, Scott, chi-squared. Then we did generalized linear models using Poisson and log-link, which gave us adjusted prevalence ratios. Additionally, for the Monitoring the Future survey, we also, because of that survey did ask how often and how many times they've used it in the last year, we also examined the frequency of use of each drug in relation to depression. And then at the very end, you can see just the list of other confounding variables that we did adjust for in our analyses. So we'll start off with the adolescents. First off, just in terms of just the past year recreational ketamine use, we did find that there's an N of 149, which is weighted at 0.9% of that population. On biovariable tests, we found that those reporting past year use of each drug, other than alcohol, they were more likely to report having a high level of depressive symptoms with P's less than 0.01. And this figure on the right is the multivariable models that we created. And as you can see at the very top, ketamine was associated with the highest risk for reporting a high level of depression with an APR of 1.55. Then it was followed by use of cannabis, and then followed by non-medical use of tranquilizers and amphetamine. And then interestingly, you can see at the very bottom, alcohol was actually associated with a decreased risk for reporting a high level of depression. And then of course, everything else in between were not statistically significant. And then because we did find that ketamine was associated with reporting a high risk of depression, we also looked at the frequency of past year use in relation to depression. So starting with ketamine with 0 as the reference, we found that if they reported using ketamine 1 to 2 times, the APR was 1.37. If they used ketamine between 3 and 9 times, the APR is 1.65. If they reported using ketamine greater than or equal to 10 times, the APR is 1.70. So in other words, there was a dose-response relationship with ketamine to the point where if they reported using greater than or equal to 10 times, there was a 70% increased chance of reporting a high level of depression. So what about for adults? So in the adult survey, the past year ketamine use, the N was 484, which is weighted at 0.2% of that population, of the aggregate population. On bivariable tests, again, we found that those reporting past year use of each drug other than, those reporting past year use of every drug were more likely to report past year major depressive episode. And then here you can see the graph for the adult survey in terms of the multivariable models. And you can see ketamine is actually there in the middle. And so what happened, we found that, although ketamine was associated with an increased risk for experiencing depression in a bivariable manner, 0.6% versus 0.1% with P of less than 0.001, we found that this use was actually no longer a risk factor in the multivariable model. We ended up getting an APR of 1.23 with a 95% confidence interval that did include 1. And then you can see, however, that past year use of marijuana, misuse of prescription tranquilizers or sedatives, misuse of prescription opioids, methamphetamine, and LSD were all associated with reporting a past year major depressive episode. Interestingly, you can see at the very bottom, you see that past year use of ecstasy/MDMA was actually associated with the decreased risk for reporting a past year major depressive episode. So in summary, we found that past year recreational ketamine use is a risk factor for reporting depression among adolescents in a dose-response-like manner, but not consistently among adults in the United States. And then just to briefly go over some limitations and then followed by a brief discussion. Since this is a survey, it's certainly subject to social desirability and recall bias. It also doesn't differentiate between those using for medical versus recreational purposes. Additionally, individuals living in institutionalized settings, such as prisons and jails, were not represented. And then lastly, because it's a cross-sectional survey, we are unable to determine the association between substance use and depression. And this last point was something that I just wanted to talk about a little bit further, just in terms of the question of, the chicken or the egg, right? Is it that ketamine use causes depression, or is it that those experiencing depression are more likely to use ketamine? And, there is evidence for both sides. There's, lots of reviews and longitudinal studies that have shown that, ketamine does have abuse potential and long-term effects. Long-term use has been associated and been shown to cause cognitive impairments, depression, psychosis, as well as bladder damage and cystitis, which many people have talked about today and yesterday as well. Additionally, there's also research showing that people are using it for self-treatment as well. Probably one of the notable things is, it creates this unique, dissociative effect, kind of this out-of-body experience where you can, escape. And certainly if you take more than heavier doses, then you can get into the so-called K-hole as well, that many people might want to use if they were to escape from depression, for example. Additionally, just in the context of all the increasing research and the media attention and rising ketamine clinics, it's certainly possible that it may be affecting people's perceptions of the risk of using ketamine, and it might be influencing subsets of people to use. And that's indeed what some researchers have found. This one on the left by Dr. Palomar. This was done in the last year. What they did was they interviewed, or they did a survey of over 200 people going to nightclubs in New York City and asked them about their past year use of MDMA and ketamine. And then they also asked them, whether or not they've seen the perceived medical benefits in the news and whether or not it would affect their willingness to use it in the future. They found that, of that sample of over 200 people, 10% had endorsed, saying that, because of the medical benefits of ketamine, they would be more likely to use ketamine in the future. And then additionally, of those who had used ketamine in the past, 50% of them said that they were more likely to use ketamine because it's been shown in the news to be more helpful and more beneficial. On the right side is something somewhat similar. These authors just looked at the print news media and how they framed ketamine. They found that, in the beginning of the 2000s, ketamine was in the news was more looked at in a negative connotation, the abuse associated with it, the negative effects. And then once you get to, the late 2015s or later on, they found that there was significant change in perceptions, talking about its use to treat depression, how it can be very effective, and kind of just this treat-all kind of thing. And then certainly there could also be indirect associations that might not be able to know about. For example, the typical demographics of those who use ketamine usually are adolescents and young adults. These drugs are often used in clubs and raves. And people who use ketamine often are polydrug users. So it's possible that the associations might be, for example, maybe it might be people who are likely to have access to these drugs or access to these venues and raves, as opposed to just this direct relationship between them. So in conclusion, to our knowledge, this is the first national representative study that evaluates the extent to which ketamine is used recreationally relative to other common drugs among adolescents and adults reporting depressive symptoms in the United States. Additionally, although recent trials suggest that ketamine administration in clinical settings is efficacious in treating treatment-resistant depression, our study demonstrates that past year recreational ketamine use is a risk factor for reporting depression, at least among adolescents. And lastly, understanding why ketamine use is a risk factor for reporting depression is imperative to minimize harms and address the needs of this vulnerable population. And those are my references.
Thanks, Kevin. That was great. There is a few minutes for questions. Yes.
Sanne Smit from Groningen, Netherlands. Thanks for your presentation. And these findings are actually in line with the current survey from the Netherlands, or a recent survey from the Netherlands. And one of the things that people also said that they thought ketamine must be safe because we treat it as, or we use it as a medicine. Is that something you recognize? And if so, do you think we should, as doctors or researchers, should do something with that?
Yeah, I mean, that's a really good question. One thing that I would love to learn more about, and I've looked for qualitative studies and whatnot, is just, how was all this news media of ketamine, and not just ketamine, but, recently with psychedelics especially, how is that affecting whether or not people want to use it in the future, or whether their perceptions of risk? And so that's something that certainly we can continue doing with national representative studies to look at these changes in perceptions of risk and harm. But yeah, I mean, it's a great question, and I'm not really sure what the answer to that would be and how we can frame these things, but it does seem like, we would expect, given all this the news media, that the prevalence of use might increase because of it.
Other questions? So while if anybody's thinking of a question, I have one for you, Kevin. So I was interested in the one for the adults, that heroin actually wasn't associated with depression. So that makes me question is there an explanation for that?
No, we didn't look more specifically into that one. There's certainly many things that could be going on, maybe, polydrug use or just maybe looking at specific demographics, because we didn't stratify by the demographics. So that's certainly something that, we could do in the future, but it's not something we looked at.
And then I'll add a comment. When you are talking to the media, they have an agenda already. So you have to be really careful. You basically have an 8-second soundbite. So it's really, you have to be careful how you say that. But I've had media people call me. I've had the most recent was, we've done a lot of positive studies on ketamine. We want to do a negative one. So, I mean, this is the type of stuff you do get from it, but it is important. I think the recent US, I know Nora Vokow was just also mentioning that looking from the CDC database, there is an increased use of ketamine and most of the psychedelics too over the past 2 years too. So it clearly is. Any other questions? Yes.
Hello, thank you. Really interesting presentation. I wondered if you had any thoughts about why the relationship between ketamine and depression is different among adolescents and adults. So why?
Yeah, that's a really good question also. And the best answer I can come up with is, usually, like I mentioned earlier, ketamine is used recreationally in club contexts and raves and whatnot, and festivals, things like that. In the US, you have to be 21 and older in order to be at these events. So it's possible that, at least among adults who are using it, they might not necessarily be depressed. They're using it more for recreational, for fun purposes. Whereas if you're, 15, 16 years old and adolescent in the US, the reasons for using it probably are very different than going to a club. It might be using it to actually self-medicate your depression, for example, or causing it. So that's the only thing that I could think of, but I've tried looking online as well, or looking through studies, and there's not really much there.
Thank you, Kevin. Thank you.
Thank you.
Perfect. I'm sorry, I think to stay on time, I think you have one more and then.
What about the UK? I mean, you say the Netherlands is on par, same sort of, numbers. What about the UK? Does anybody know how we're doing? Because we drink at a very young age. The adolescents do. So, I mean, we have a good, we're all, you can't drink until you're 21. So, I mean, I think they might be quite considerably different.
I think we can say, Celia is the expert on this, but
Yeah, where's?
Use is higher in the UK than in the US. For
can you
sure.
speak up?
The incidence is higher in the UK than the US of ketamine use as well. I think we probably use more drugs and drink more alcohol, as you said, than people in the US, but particularly among adolescents. Yeah.
Thank you.
All right,
Thank you,
thank you.
Kevin. Thanks. So.